Arjun, it's great to have you jump on to talk to us today, my friend. Really appreciate your
Great to
time.
be here, Paul. Thanks for having me, man.
You've been working really, really hard for a number of years on a whole range of things for Script Assist, but this is a particularly exciting moment because you've launched Find a Doctor. I'd love to know what Find a Doctor is, what it does, and how it changes the landscape. So let's jump right into it and give you an opportunity to tell us what is Find a Doctor.
Yeah, sure. As you've mentioned, we've been hard at work for a few years trying to build software and successfully building software that enables the prescribing of medical cannabis as part of regular private healthcare, enabling doctors to provide care and provide a streamlined service to their patients when medical cannabis is appropriate for them. And Find a Doctor is really the culmination of all of that work together, finally coming to a place where patients can start the journey on Script Assist. Up until now, the journey has been initiated by clinicians, and it's really when they think that it's appropriate. But obviously, we know that there are patients out there who are seeking medical cannabis and are looking for a clinician who's willing to prescribe, and they're not so easy to find. So what we've been doing, and obviously we've been working with doctors for a number of years now, and we've been training hundreds of them over the period to get them up and ready to prescribe medical cannabis. So Find a Doctor is really the launch, finally, of a patient proposition that enables patients to access their doctor and kind of start their journey on a digital basis and continue their journey all the way through for their entire prescribing lifetime through that digital experience. So from our app, patients are able to find a prescribing clinician based on where they are, based on the conditions that they're prescribing for. They can see pricing, biography, all of the information that they need in order to make a decision. Patients fill out an eligibility questionnaire and submit medical records before they're able to inquire with these doctors. So doctors have all of the information that they require as part of that initial eligibility review process. And then from there, the entire process continues within your app. So as soon as a doctor accepts you, you're able to book an appointment directly in the app. You can join your video consultation with that doctor directly from your app. Prescriptions happen on the platform, so you receive real-time tracking and real-time inventory availability of all the products that we have on our formulary. And you can continue to manage your prescription and your journey through your app. You can pay for it, you can track your prescription, you can order repeats directly through the app, which doctors can approve with one click and then print and send the prescription off to continue the journey. So this is really the culmination of the start of the journey, finally being able for patients to start it digitally and continue that journey throughout their kind of entire prescribing.
It's awesome because we've obviously known each other for quite a few years now, and we've known that we've been a big supporter of the work that you've been doing to try and help the sector expand out of that traditional cannabis clinic model, which I don't think we've both talked about this on shows that we've done together. I have an issue with that. It's a sensible model.
No, and they definitely serve a purpose.
Absolutely. But there's more to be done. And I guess this sounds like that's been part of that process and journey of how can we move medical cannabis more into mainstream private healthcare and create a function by which everything can be done in one place rather than you've got to go over here and then speak to that person.
Exactly. And it's kind of the first time that all of that's in one place now from a patient or for a doctor. You can really start everything within Script Assist and never really need to leave the ecosystem because everything's available to you at the tip of your fingers. We've seen people book consultations for the same day, have them accepted, have their consultation. It can all work very quickly as well because of the nature of the fact that everything is digital. And we make sure that all of the necessary data is collected at the right point in time. So whenever anyone's needing to make a decision about anything, everything is available that they need. It's really a step change for us in terms of finally making it accessible to patients, not only those that know that they're looking for medical cannabis, but also those that are trying to find an alternative therapy and trying to bring those people into the funnel and making medical cannabis available to them. Yeah. It also allows them to find a doctor who's looking after their holistic care. That's the kind of what we're looking for here. And kind of the upside for that is that if you're covered by private medical insurance, which quite a lot of people are these days, and your insurance covers your indication and the specialist that you're trying to see, then that consultation could be covered by medical insurance. So that enables a whole new population that can access this. And I can find a prescriber who has access to the medication and isn't going through all the hoops of trying to plug it all together themselves, which is what we've seen.
Yeah, that's great. That can really change things for a lot of people. And private healthcare is on the up as an industry, isn't it? In a sector, more and more people are getting private health. I'm not going to turn this into an NHS discussion.
No, definitely not.
Avoid that subject. But more and more people are getting private healthcare insurance, and that sector is booming. It sounds like there's something in there as well around this being very much targeted at clinicians and allowing their journey of prescribing being safer and just a smoother process. And again, some of those models that exist elsewhere where there might be some tension points around prescribing the medication.
Yeah, completely. And it's built for specialists, right? Our tagline is designed by doctors for doctors, right? And the idea behind that is it allows a clinician, and as I say, is find a doctor, not find a clinic, right? It allows a clinician and a doctor to promote themselves to a certain extent, but also have a listing that says, I am a ready medical cannabis prescriber, but I'm here to look after you as a patient. Now, if I think medical cannabis was appropriate for you, then I will and can prescribe it to you. And I know how to do that because I have all of the tools that I need in order to do that. So this is really an entry point for clinicians to also say, like, this is normalized. We're trying to drive a normalization effort here to say these clinicians who are well respected within their industries and their spaces and have been doing this for a long time. We've had some that have been doing this for 30 years, right? And they've been a specialist in their indication for that period. So it's well regarded specialists saying that this is an alternative therapy that I know has worked for my patients. And I want to be out about saying the fact that I'm prescribing it and I can prescribe this for my patients. So it really is a change in terms of perception from a clinician's perspective, but also enabling a straightforward, easy journey, but that checks all the right governance measures in place. So we take a full eligibility questionnaire for every patient, which they have to fill out before they can submit an inquiry. And we also ask them to upload their medical records, so doctors have the ability to review all of this information before they make a decision as to whether they think they may be eligible or not. And then we know that this has been something that's been a tricky bit that people have had to kind of overcome over the years, and trying to build a digital solution that plugs it all together has really been what we've been working towards throughout these last few years. So it's really nice to kind of finally see it all come together.
Yeah, it must be. I mean, you're still working incredibly hard. I know you are. You're still like, but it must be a moment where you can just be like, oh, right, that's nice. All that hard work and effort culminating.
Yeah, and to be honest, it's really nice to see it being used, right? We've seen a flurry of interest since we had our press release a couple of days ago, and we're seeing more people come into the platform and into the system, registering for accounts, trying to find a doctor, submitting inquiries. So it's really, really positive and really heartening to see the fact that it's finally coming together and patients are taking the first step and they have the ability to do that without having to go through loads of hoops and hurdles.
Yeah, it's great. There's something really interesting that just popped into my head as you were talking there about the patient experience, and it's really relevant because I think it was earlier today that I saw something come up on Reddit about, it's Twitter actually, about the speed by which people are seen by the doctors. So kind of like get booked in at a clinic, it's like 5 minutes, there you go, you're going to have these strains, off you go. And the person reflecting and saying, is this normal? Like, that was 5 minutes. Like these consultations, I imagined being a bit more patient, person-centered, but I guess that's one of the risks of that model where it's all about prescribing. It's all about kind of just getting people through and out. But what we're talking about there is clinicians who are given a much more holistic, thorough
completely
experience.
As I said, these are specialists within their indication areas. They're there to see you because you have pain or you have a psychiatric condition that needs to be reviewed. And like the shortest consultation we have as an initial consultation, I think is 45 minutes. So there's no risk of you going in and being seen for 5 minutes and then moved off.
Yeah.
Because the idea being that these are clinicians who would see you if you were going to see them for another medication. It's not about the medication. That's not why you're there. You're there because of the condition that you have. And that doctor is there to treat you for that condition. And if they think that medical cannabis is appropriate, then they know how to and can prescribe to you. And that's kind of the journey that we're trying to facilitate. That fundamentally medication always sits in doctors' hands. And what we're prescribed, especially in this country, is designed and decided by our clinicians, right? We told them we have this hurts, and they tell us have this, right? And that's kind of how it's always worked. And we want to kind of continue it working that way. I want to be able to go see a pain specialist to say, I've got pain. And they say, okay, well, have you tried this? Have you tried this? Okay, now maybe you should try this. And if a feature like this or a tool like this had existed when I was originally looking for a doctor for mum, it would have made my life so much easier, right? I would have known that, okay, here are a set of pain specialists that are based up and down the country. I can do my personal research on those doctors if I want to, because they're all public figures and they all have public profiles that I can see their history and see where they were trained and all these kinds of things. It's not an ephemeral doctor behind a clinic or behind another front that I don't know who I'm seeing. And I can be comfortable in the fact that I'm going to get the holistic care that I'm looking for because of the condition that I have. So that's really what we're trying to achieve here.
That's great.
And the fact that private health insurance can be part of that journey as well makes it even more accessible for people and allows people to access this that may not have been thinking about it or may not have access previously.
The main thing that jumps out for me as a consumer of many things through my phone is that like having everything in one place through an app is such a modern way in which we interact with the world.
Yeah.
Very refreshing to be like, I can download this app and I'm in charge of everything. I'd have to start making phone calls and going off here. Like it's all through this. Everything is managed and sorted out through this app. And knowing the challenges that patients have with regards to medication repeats and just the whole process, again, having it all in one place where you can see the medications, order the medications, and then track them, again, addresses a lot of pain points that I guess you've seen come up regularly through patient, through market research, through Reddit forums, all that kind of stuff. So
exactly. And things like our formulary on the platform, both for doctors and for patients when they're ordering a repeat, only shows products that are available. We know the inventory of all of the units and all the products that we have. So we only show people products that are available at the point of prescribing. So there's no risk of a prescription being written and the stock not being there when it gets across to the pharmacy, or you requesting a repeat and the stock not being there when the doctor comes around to approving it. So these little features that we talk about and are kind of hidden behind the scenes are things that make everyone's lives better and make everyone's lives easier, especially when we've seen the kinds of issues that can arise from these kind of problems. We even allowed, for example, doctors print their FB10s directly from our platform. So there's no risk of them writing the wrong thing,
nice.
Right? Which we've seen happen many times before, right? And also doctors' handwriting is not great.
It's awful.
So it's kind of hard for pharmacists to read it and say whether this is right or not. Right? So we kind of get rid of that problem entirely and say, here, just print, please, because then everything is done. We know exactly what it's got. So it's things like that we're constantly developing new features to make things easier for people. Like, for example, for our naive patients, we've just added a feature where if it's your first flower or your first oil prescription, you get a notification that says, here's some instructions on how to use this. And it will link you directly through to the right place in the FAQ, so you have the instructions at hand when you're reviewing your prescription.
You've covered a lot of things there in terms of how this changes the landscape from that sort of evolution outside of a classic cannabis clinic model into integrating a lot of features which normally a patient would have to kind of access elsewhere, same for the clinician. Are there any other ways in which you think this is kind of like changing the landscape or you foresee it having an impact on the sector?
I think this is the first time that we've got a directory where we've got prescribers who are finally coming out and saying, like, I prescribe medical cannabis. I don't work in a cannabis clinic. I do this on my own private practice when I see my patients that are coming to see me anyway. And I think that's a really good first step towards normalization of this into private healthcare, which is what we're here to do. I think we're having lots of very interesting conversations, not only with private clinicians, but also with private healthcare institutions. That enables us to really drive change in enabling normalization and drive change in terms of making it more accessible for people. It also provides the ability to get cannabis and medical cannabis from a doctor who's looking after your holistic care, right? And that is something that we're very, very passionate about here, that you should be seeing your doctor for your condition, not for your medication. And that the doctor is the one who is prescribing that medication to you. So it's really making sure that we can provide those doctors to the patients who are looking for that care and looking for that coverage and that kind of that experience. And also have the first fully digital medical cannabis experience, I think, is the big change in landscape for me, right? No one else has a fully digital experience from start to end, and the ability to come into the journey with the idea of potentially being interested in getting a medical cannabis prescription, all the way through consultation, prescription, repeat management, all from your phone, right? That is a big step for us, and the fact that this is what we've been working to for a number of years. And it's nice to finally see it all come together in one place and enable patients to really take charge, as you said.
Yeah, it's great. Arjun, I know how hard you've all been working behind the scenes to bring this into fruition, but as someone who, like myself, who cares deeply about the evolution of the industry and better patient experience, it's great to see it out there. Thanks, and for anyone that's watching the video, it will be in the description. Whatever platform this is out on, it will be underneath the video, whether it be Twitter or LinkedIn or YouTube or wherever else.
Yeah, it'll be somewhere down
it will
there.
be, yeah. There's so many places that put things out. It's underneath this video where you can go directly and download the app. Arjun, thanks so much for taking the time out to speak to me, my friend, and all the best with the continued launch of the app.
Thanks, Paul. Always great to chat.